Hi, I'm Dr. Nick Page, and today I'll be presenting findings from the 2021 SHRN Student Health and Wellbeing Survey, based off our recent report that was published in April of this year. So the Student Health and Wellbeing Survey. So this is an electronic self-report survey that is administered to students who attend SHRN member schools. The original questionnaire was developed from the World Health Organization's Health Behaviour in School-Aged Children survey and still maintains a number of questions from that survey. And every 4 years, that survey is embedded within the SHRN Student Health and Wellbeing Survey to enable international comparison. So the Student Health and Wellbeing Survey is delivered alongside the School Environment Questionnaire, and that's completed by school senior leadership teams. And that asks about school-level policies and practices. In terms of what the survey aims to do, the main aim is to provide evidence to local, regional and national stakeholders in Wales, with the aim to be to drive health improvement activities across the school system. Who participates? Well, in 2021, we had the highest response rate we've had to the survey to date. We had over 120,000 young people, representing about 73% of 11 to 16-year-olds attending SHRN member schools in Wales, from 202 of our network member schools. So that's around 95% of our network member schools. In terms of the report itself that we publish, we provide breakdowns by gender, year group, socioeconomic status, ethnicity, and local health board for a range of mental and physical health and wellbeing indicators. In terms of what the data is used for, I've mentioned obviously one of the aims of the survey is to provide evidence throughout the sort of school health system. And in combination, the two surveys provide a robust data infrastructure for Wales around school health. Really, this then allows for sort of a whole school approach perspective, in the sense that we're collecting data from students that can be linked to their school environment. The student data itself is valuable from a national level for policy monitoring and evaluation, so thinking of things such as the whole school approach to mental health, but also more broadly in terms of COVID-19 recovery strategies and other policies that are ongoing within Wales. From a health surveillance perspective, the data obviously is useful for monitoring of population health trends for adolescents, but also for national and regional health action planning. And again, as I mentioned, because of the embedding of the Health Behaviour in School-Aged Children survey every 4 years, that also enables us to conduct international comparison work. And actually, one of the other values of collecting the data above and beyond some of the things that I've mentioned is actually it provides an infrastructure to support research studies. And I'll talk a little bit about this later on in the presentation. So in terms of some of the key indicators within the student survey, so we cover a range of topic areas, so from mental health and wellbeing, school life, physical activity and diet, family and social life, relationships, substance use and gambling, general health topics, and we also have some special topics that come in and out of the survey rounds. So, for example, in this particular survey round in 2021, the special topics looked at smoke-free environments and young people's knowledge and awareness of the United Nations Convention of the Rights of the Child. One of the values in collecting this data biennially is that it enables the tracking of some of these key indicators over time. So some indicators that have been included in the survey since before SHRN was established in 2013, when it was previously just based on the Health Behaviour in School-Aged Children survey. Some of these indicators will go back to the mid-80s when that survey started. So that allows long-term tracking and monitoring of trends over time, for example, in smoking. So in terms of findings from the 2021 student survey, and those that are published within our national report that's freely available on the website, I've just selected sort of 3 indicators really from a few of the key topic areas that I'm going to just run through today. What I would say is that there's caution needed when interpreting some changes over time. So within the graph in front of you, you'll see data from our 2019 survey and comparisons to our 2021 data. So for this presentation, we haven't done any statistical analysis, so no statistical testing. Usually that's because of our large sample size. So because our sample exceeds 100,000 young people, we know that actually when we're comparing changes over time, say for boys or for girls, that given the large sample size, actually even minor changes in percentage are likely to be significant. The smaller sample that is available for gender minority students, here it says neither word. That's because the option in the survey is neither word describes me. That sample is smaller. So in 2019, these students represented about 1% of the total sample, and that grew to 3% of the total sample in 2021. And so there's a level of uncertainty around the estimates for this particular cohort, where these estimates are potentially more volatile, which means obviously there's more uncertainty and a greater margin of error. So we just have to be more cautious when we're looking at changes over time for that particular group. So just having a look at the indicators here on the screen. So we have life satisfaction, we have loneliness during the most recent summer holidays, which would have been 2021. And also we have the total score on the strengths and difficulties questionnaire, which is a sort of screening tool for internalizing and externalizing symptoms within young people. So it includes things such as emotional symptoms and sort of conduct or behavioral disorders, and sort of hyperactivity and inattention. So in terms of looking at life satisfaction, so again, suggestions here is that there's been sort of minor decreases in 2021 compared to the 2019 survey, minor increases in loneliness between the two surveys, and some growth as well in the sort of total SDQ score. This is looking at the percentage of young people who scored very highly on the SDQ based on some validated thresholds. And so the suggestions here, if you're looking at the SDQ, for example, is actually there may be a minor increase in the proportion of boys that would fall in that very high category, but more growth among girls, and again, potentially more growth among gender minority students. But again, as I said, that growth might be subject to greater levels of uncertainty. In terms of school life, here I'm looking at school pressure, speaking with staff, so in the sense, in terms of how young people feel they can confide within staff within their school, and also the level of perceived mental health support within the school. So in terms of taking the first indicator, again, there's some suggestions that there's been some growth in perceived levels of school pressure. So this is young people who have felt some level of school pressure around their workload specifically. So again, some suggestions of increases there, more so amongst young girls and gender minority students. In terms of confiding in school staff, so those that agreed that there was a staff member they could confide in if they needed to, again, we have slight decreases here among boys and girls, although potentially a small increase among those gender minority students. Again, proceeding with caution with these estimates. And again, in terms of the percentage of young people who agreed there was good level of mental health support available within their school, we have slight decreases compared to 2019, but fundamentally we're looking at sort of over 2/3 of young people who do agree that there was good levels of mental health support in school, despite those slight decreases between the two surveys. Looking now at physical activity and diet indicators, so we're looking at the proportion of young people who meet the daily recommended physical activity guidelines, which is sort of 60 minutes per day. We're looking at young people who participate within active travel in their journey to school, so those who walk or cycle to school. And we're looking at the proportion of those who eat breakfast on weekdays, so obviously on school days. So here, in terms of physical activity, we don't really see much change compared to 2019, really for boys and for girls. Potentially a larger decline among gender minority students though. For active travel, we see no change between the survey years in terms of the percentage of those who are engaging in active travel to school. And in terms of breakfast consumption, we have seen, again, historically, that boys were more likely than girls to eat breakfast every weekday. And we've seen some further declines in that over time. So here we still have over 1 in 2 boys who would eat breakfast every weekday, although among girls we've got more like 2 in 5, with some reductions as well in 2021 compared to 2019, and some similar reductions among gender minority students as well. Moving to substance use, we're looking here at sort of regular smoking, so that's at least weekly smoking, so that includes the daily, weekly smoking. We're looking at the same in terms of e-cigarette use, so we're looking at sort of daily, weekly vaping, and also we're looking at sort of daily, weekly alcohol use among students. So again, so the prevalences tend to be lower for these because obviously they're sort of regular use of these substances. In terms of changes over time, again, rates of smoking are relatively low at the moment and have been at around about sort of 4% nationally for the last so many survey rounds. But we've seen now an overall slight decline to 3%. You can see there's a little change among girls, slight drop among boys, but potentially a larger decline among gender minority students. In terms of vaping, we've seen here some evidence of some potential growth in sort of more regular vaping, possible slight increase among boys, potentially larger increase among young girls, but actually the possibility of decline among gender minority students. Again, with this, numbers will be small and levels of uncertainty around those estimates would be greater. In terms of alcohol use as well, sort of minor changes over time and some slight contrast between boys and girls, in that a slight decline among boys compared to a potential minor increase among girls. And again, a potentially large drop in regular alcohol use among gender minority students. So that was just a very, very quick sort of high-level overview of a couple of key indicators with comparisons to our previous survey in 2019. Just to summarise just a couple of those sort of key findings from a few of those figures. So in terms of sort of mental health symptoms, and this is captured by our strength and difficulties questionnaire, it was around about 1 in 4 young people fell into that very high levels of mental health symptoms category in 2021. That's an increase from 2019, where it was closer to 1 in 5. That SDQ measure, as we said, captures a multitude of mental health symptoms and can be split into a number of subscales, including around emotional symptoms and conduct problems and peer relationship problems and hyperactivity and inattention. Particularly among young girls and gender minority students, when we're thinking of things such as emotional problems, we've actually seen a greater increase compared to boys. The majority of young people surveyed agreed that there was a staff member within their school that they could confide in, and actually that school mental health support is good. So we showed those percentages, which was sort of 2/3 or more of students that would agree with those statements. There was a slight declines in these percentages compared to 2019. And I suppose one of the key changes in indicators for school life was around actually increased schoolwork pressure as well. So there was some potential growth in the perception by young people that they feel a certain amount of pressure around their schoolwork. Looking at physical activity and diet, I picked out breakfast, specifically around young girls' consumption. And actually for 2021, we're looking at less than 2 in 5 girls reported eating breakfast on weekdays. So that would be each weekday. Where boys, it was greater. It was around about more than 1 in 2 boys would eat breakfast every weekday. And e-cigarettes and vaping is increasingly topical, and there was some evidence here that there's been growth in regular vaping among young people from 2019 to our 2021 survey. Again, regular vaping was still relatively rare in the sense that it's quite low proportions, but actually, particularly among adolescent girls, you saw that increase. So from 2% up to 7%. So that was sort of the largest change that we looked at here. I just wanted to touch briefly on data linkage. It's not something that's in the national report or included in any of the school feedback reports or anything that you would have access to. But I think it's an important thing to touch on, just to give an update on our numbers for data linkage and some of the key benefits of data linkage that since we've introduced it into the survey. So some of you may or may not know that we piloted data linkage in the 2017 survey with a smaller sample of schools, where we gave students the option to provide their name, their date of birth, and their postcode, and to consent to their information to be securely linked. And this is an anonymous linking to potential records, things like medical records, for example. So this would be through the SAIL data bank held at Swansea University. So that work was done, and then we had a full rollout of those processes in 2019, where schools are asked to consent to be data linkage schools in the first instance. Before then, students are asked to provide their consent to link their data, and if they do consent, to provide the linkage fields described above. So in 2019, that first wave of full rollout, we had 136 of our SHRN member schools agreed to be data linkage schools, and within those schools, we had just under half of students who consented to have their records anonymously linked. And that, once cleaning took place, that meant that there was around about 32,000 linkable cases that were deposited within SAIL and were able to be linked to young people's medical or educational records for research purposes. So in 2021, the most recent survey, we've managed to increase on that number, which is fantastic. We now have 166 data linkage schools, so almost 80% of our SHRN member schools are data linkage schools, and that student consent has increased marginally as well, still around about the 50% mark. That data is currently been cleaned and uploaded to SAIL, and we're just waiting to see how many linkable cases we have. So I mentioned that data is deposited in SAIL. So we've now signed a data sharing agreement with SAIL to make that data available as a core restricted data set. So that means that researchers can apply to SAIL to access this data, going through SAIL's governance processes. We, as a SHRN team, will have sight of those applications and get final sign-off of those applications. I think it's really important to state that no schools or students can be identified as part of that linkage process. That's why it's anonymous linking. So it would just be linking of students to administrative records such as medical and educational records, but completely anonymously. And the idea, really, the benefit of it is to further scientific understanding around young people's health and well-being. So as a few examples, there was a paper published in 2022 led by Anne John at Swansea University, and that's used the SHRN data in the pilot study, and she was able to link the SHRN data on bullying to students' records of self-harm. And that study was able to show that pupils were twice as likely to self-harm following in-person bullying compared to their non-victimised peers in Wales. So that was a really important finding, and it wouldn't have been possible without the data linkage. We also have some other studies, that's a SHRN adopted study supported by SHRN in the network at the moment that are hoping to use the linked data. We have one that's exploring links between students' mental health and their built environment. And we also have a study that's looking at specifically at risk and protective factors for children receiving social care. In terms of a quick sort of update in terms of the survey and the network, just to say, obviously, we're in 2023 now, so we have the next round of the survey is due to commence this autumn. Bringing it back very, very quickly to data linkage, we would be able to, following this survey, we have the potential then to actually track young people who consent to linkage who first would have joined the school in 2019 through to 2021 and then through to 2023. So we could actually follow potentially a cohort through the school for the first time, which actually is potentially increasingly powerful, especially around young people's sort of health and wellbeing trajectories and also the potential impact of COVID in the middle. So in terms of the data collection this year, so the student survey, the student health and wellbeing survey, registration opens in June, so that's the 12th of June, and registration will close around the 21st of July. The data collection period begins on the 18th of September and runs to just before Christmas on the 22nd of December. This year, or this round, we're actually going to run the school survey at the same time rather than re-recruiting and running that the following year. So data collection for the school environment questionnaire, which captures those school level policies and practices, that's going to open the 2nd of October, and that will also then run to just before Christmas on the 22nd of December. I think two updates, sort of significant additions to this survey round in 2021 was the SHRN data dashboard and the SHRN animation. So for those of you who are unaware, we have a data sharing agreement with the Public Health Wales Observatory, and certain SHRN indicators are shared with the observatory, and they've created a publicly accessible data dashboard at local authority level to display some of the SHRN data. So this will look at specifically data over time as well. So they have data from our 17 and our 19 and now our 2021 survey. So you can start to explore some trends at local authority level. Again, there's no identifiable data in terms of students or schools. And actually, as a network, we're also at the moment looking to develop a prototype school level dashboard, which would potentially have some similar functionality in terms of exploring changes in your school level data over time. These would be similar to your current school feedback reports. Access would be restricted only to the school itself. So it would work in the same way as your current PDF reports, but would be more dynamic potentially. So that work is ongoing at the moment. And you may hear from me and others within the network who are looking for some support from schools in co-developing, co-designing those dashboards. And the SHRN animation, again, hopefully some of you would have seen the animation. It's available on our YouTube channel, and that's a short animation just on some of the key findings from the survey, the most recent survey, and says a little bit about what the network is and does in a really accessible, fun way that can be used with students or with maybe parents. So it's available in both English and Welsh, and I'll share the links shortly as well. So thanks for listening today. I hope that was informative. I hope that if you want to access the national report, you are now able to, and you can go to the website to download that. The animation, as I mentioned, is available in English and Welsh via the SHRN YouTube channel. But also, if you're interested in looking at the Public Health Wales Observatory dashboard, that's also available at the link below. So I suggest you take a look at that if you're interested. Thanks very much.